Today I'm talking about spatially resolved temporal networks, or online unsupervised representation learning of high-frequency time series. In the intensive care unit, patients rarely exhibit standard pathologies. On the bottom left, we can see what a standard intracranial pressure waveform looks like. It has a P1, a P2, and a P3 bump. Intracranial pressure is just blood pressure for the brain. When a patient exhibits different pathologies, the relationship between the P1, P2, and P3 bump changes. But this is only what happens in theory. In practice, if we look at a real intracranial pressure waveform, we see that there's a lot of variation in what happens in real life. And this is because there's high intersample and high intraclass variability for each patient. And so the way that we can tackle this is through online unsupervised representation learning. And this is perfect for the context of the intensive care unit. It's online, which means it can be conducted in real time, and ICU waveform data is sent in real time. It's unsupervised, which means it's not dependent on labeled data, which is difficult given the high variability in patient data. And it's a representation, which means that it's interpretable for clinical action. Clinicians can act on it based on what the state is assigned to a given patient at a given time. And so we actually formulate this as a given problem, or two specific problems. First, we want to map a time series xt of length k to a discrete state st. And second, we want to map each state and each input time series to a forecast or an output time series with a prediction window w. We do this by feeding this input into two networks with two distinct but related goals. The goal of the R block is to learn a forecast, and the goal of the S block is to learn a state representation. And they send information to each other in order to actually help collaborate and cooperate and come up with better outcomes. And so we wanted to test whether or not this method, which we call spatially resolved temporal networks, or SpaRTEn, would work well in an online setting and on representation tasks. And so we performed experiments on an A100 NVIDIA GPU, 10x bootstrap, and reported 95% confidence interval across 5 different data sets. And we show that first, the online forecasting ability of SpaRTEn far exceeds those of other models like LSTM and beats TF temporal fusion transformers and autoformers. And second, we show that we can create actual real-life representations. So we take this raw waveform data, we use SpaRTEn to create clusters, and we validate that those clusters are good based on a silhouette score, and then we visualize it. And we can see that when we visualize it, we're able to generate different states that represent different sort of outcomes. So we have a state for hemorrhaging, a state for management, a state for decompensation, and a state for hypertension and hypotension. However, there are a few limitations. First, that the gradients and states learned by SpaRTEn can be highly unstable, and second, it doesn't work for multimodal time series. Just the key takeaways is that we developed a novel method called SpaRTEn for discrete representations of time series via unsupervised learning and using a forecasting objective, and we anticipate that further improvements in size and optimization details will only continue to further improve the SpaRTEn network.